to the What If It's Not Depression podcast. I'm your host, Dr. Achina Stein, and today I am introducing to you Danny Williamson. She wrote a wonderful book called Wild and Well. She's a graduate of Vanderbilt University School of Nursing and is a nurse, midwife, and family nurse practitioner. Danny incorporates the art of medicine by balancing traditional and integrative therapies, and she encourages her patients to step out of the realm of normal and reach optimal health. We all know, you must know by now, that normal doesn't mean healthy, okay? So she owns an integrative family medicine in Franklin, Tennessee. And like I said, her first book, Wild and Well, Danny's 6 Common Sense Steps to Radical Healing, is a national bestseller since being released in 2021. She believes that your health is not rocket science and healing shouldn't be as well. So if you are really excited about this interview, please join her email list for her weekly newsletter and click the like button and subscribe to my channel. Welcome, Danny, to this interview.
Thank you so much. I'm excited. This will be fun.
Yeah. One of the things that really excited me about interviewing you is because of your whole journey that started with childhood trauma, right?
Yes.
And there's a part in your book that talks about childhood trauma and the ACE score and how you came out of the ashes of that. And I'm always fascinated by how people do that. What is the switch that turns on? I always look for that. And it really comes down to this place in your soul that you reach where something turns on, right? And as I was reading about it, I felt like that's what happened, right? And you talk about rising out of the ashes like a phoenix, right? Right?
Exactly.
Yeah, you have the beautiful red hair like a phoenix. You are a phoenix. So it is great to have you here to really talk about that, because I see a lot of patients that have pretty high ACE scores. And guys, don't worry, we're going to talk about what that means. It's part of my intake, actually, when I see patients. Great. It's part of my intake. It's hers too. And when I see patients one-on-one, we do talk about it in my boot camp. We talk about how these kinds of things can affect your health. And so I would love for you to start with telling us a little bit about, your childhood journey and what brought you to becoming a nurse practitioner. And then let's dive into what is the ACE score and go from there. How's that sound?
Sounds perfect. And, from the very beginning, I grew up in complete chaos in my house. And my grandfather had died by suicide. My mother attempted multiple times before I was born and once after. She married three different men. 2 stepfathers. One was a child molester. One beat me up my senior year and was awful. And I had chronic diarrhea, chronic gut issues from all of that stress. My first colonoscopy was age 20. I had 4 of those from 20 to 44. And then I itched chronically for years in my late 20s. And then I was diagnosed with lupus. And then I was depressed and I was in a bad marriage and became suicidal when my children were little. And I knew exactly what I was going to do that day and how I was going to drive off the foot of Broadway into the river in Paducah. And turned it around when I saw my children that morning. Ella and Jackson walked in and wanted to eat breakfast. And I just knew immediately I'm not going to leave these kids with this husband of mine. And I got divorced. I lost everything, was on food stamps and a medical card. And I applied to nursing school. What? I have a master's degree in fashion design and applied to nursing school. One morning I'm standing there. I get 2 letters in January 2006. One said, "Congratulations, you've been accepted to the program at Vanderbilt. You're heading to school." I was 40 years old, oldest one in my class at that point. And the next letter said, "Congratulations, You've got, well, not congratulations. You qualify for $56 more in food stamps this month for you, Ella, and Jackson. I have those two letters side by side framed in my office, reminding people every day you can rise from the ashes. So I went to nursing school. I was still sick. I was sick still, chronic diarrhea, IBS, all the things. I got a job out of nurse practitioner school, 24 years, 10 doctors later, before a doctor ever leaned into me and said, Danny, what are you eating? Don't you know your diet controls your symptoms? And then, do you know your food sensitivities? It turned the entire trajectory around of my life 11, 12 years ago. And it has since done the same thing for thousands of patients. Well, backing up and in hindsight, now learning 5 or 6 years into practice about adverse childhood experiences, it took, when I learned that what happens to you from age 0 to 17 can set you up for a lifetime of chronic disease, substance abuse, depression, anxiety, suicide, suicidal thoughts, suicidal attempts. The list goes on and on. It changed again the trajectory of my life and my practice. And now I incorporate that into my patients' intake form, like you said, and it has really helped me take their health, help them take their health to a whole nother level, because I did not know. And I felt good, man, when I changed my diet and I cut gluten out and I knew my food sensitivities and I cut dairy and eggs. My world turned around. Joint pain went away. Depression went away. No longer itched. No longer on lupus medicine, nothing. But I never took it to the next level, right? And there was anger there, because when I was 13 years old, my mom looked me square in the eye and said, Danny, you caused me to lose the only man I've ever loved. That was the child molester. She was then married to the abuser. And there were things like that all through my childhood, and I had never let go of that anger. And once I started learning about ACEs and how to manage and know that it wasn't my fault, right? I'm not broken. You're not broken. You were born a beautiful, happy baby. And it's not your fault what happened to you. It's just changed my life. And now lots of therapy, EMDR, right. Hypnosis, just went through awake hypnosis yesterday dealing with this. And, lots and lots of integrated treatments to help with that. And I feel like I'm on a good road, and I do that with my patients. I get them to wherever they need to go to address the trauma. And so we can talk about what adverse childhood experiences are, because the American Academy of Pediatrics, I think it was Dr. Robert Block, I'm blank on that. He used the past president. He said, this is the single largest public health crisis that we've missed in the United States.
That's exactly right. Yeah, that's exactly right. Yeah. So let's pull that apart a little bit, and let's start from the beginning and just say, what was the study back in the 1990s at Kaiser Permanente? I'll give you the floor to talk about what that study was, what the ACEs are, the 10 ACEs, and what does it mean?
Well, the study started in San Diego, California, and there's a long history on Dr. Folletti and his weight loss clinic. And we don't have to get into that and how it got started. But what he did, he realized it was a weight loss clinic, and they were losing patients left and right, dropping out of the clinic after losing hundreds of pounds, dropping out. Fast forward, he started bringing patients in, interviewing them, Achina, you've lost 150 pounds. What's going on here? Why did you drop out? And he was asking questions. And one day he said, how old were you when you first had sex? And the girl said, 4 years old. And his eyes raised like ours. And he said, no, I'm sorry. I misspoke. I meant to say, how much did you weigh when you first had sex? And she said, 40 pounds. I was 4 years old. My father raped me. And he was horrified. He had no idea that incest, he had only seen one case of incest, he thought, in his entire career. Interviewing hundreds of patients later and multiple people in the clinic, he brought in other providers to interview because he thought he was saying something wrong.
Right.
He realized that a huge portion of these people had trauma. They were raped, molested, beat up, people in prison. The list went on and on. Fast forward to 1995, when the CDC got involved in this, and they started this study with Kaiser Permanente, and they interviewed 17,000 mainly white, middle, upper class people with good education and good incomes. And what they discovered was that at least 64% of those 17,000 in that bubble of a group they had at least one ACE. 12.5% out of that group had 4 or more adverse childhood experiences that happened to them. It's very common. That was a very segregated group, right? That didn't include the Black, the brown, the lower income, lower educated. So they do project that it's even higher. Honestly, the score is, the numbers are, and that's what started it. Right. And again, that was 1995. You and I went to school. You said in the 90s, I was in the 2006. Never once was it mentioned to my class of 300 and something nurse practitioners.
Right. I know it's a major landmark study. Exactly.
It is a landmark study, and it's 10 questions, which are easily accessible on the internet. You can take the Adverse Childhood Experience Questionnaire for free. You just type in adverse or ACE, and NPR has a ACE score, and it pops up, and you take it. And what it involved, the categories: physical abuse, psychological abuse, living with a substance abuser, sexual abuse, violence against the mother, could have been anybody, mental illness, suicide. Did a parent go to prison, or someone in the household with you go to prison? And then you check off each one that is applicable to you. My ACE score is a 6. Probably a 7. I didn't know my mom was an alcoholic, and I probably should include that until I was way older. Didn't know she was a functioning alcoholic. Mine is a 6. I have a 20-year shortened lifespan, what they say, than someone who has a score of a 1 or less.
Yeah, my score is a 6 as well.
Yours is a 6?
Mm-hmm. Yes.
Wow. So if we have a score of 4 or more, our chance of suicide is up by 1,200%. Right. 1,200% increased risk of suicide.
Right.
400% increased risk of emphysema or chronic bronchitis. 460% increase in depression. And the list goes on and on and on.
Right. Exactly right. Yeah, it's amazing. So, tell the audience, and I could tell the audience, but I would love to hear from you, because you're on a roll now. I'm so happy that we're talking about this, because it's so, so, so important. And you're the first person that I've been able to get on here to talk about it. Tell us why, connect the dots for me. Like, why does childhood events, things that happen in your childhood that is most people actually sweep under the rug, right? And not just doctors, but family members, right? They sweep on the rug. Oh, just get over it. It happened a long time ago. What are you worried about? You're successful now. You're a nurse practitioner. What are you worrying about? People don't realize the impact of these events. And so connect the dots as to why this happens. Why does someone have these high percentages of cardiovascular disease and chronic disease, chronic illness, suicidal ideations, mental health issues, right?
That's exactly right. Well, when you are living under chronic stress or chronic uncertainty, for me, it was, I never knew when he was going to come into the bedroom at night, or I never knew when the second stepfather was going to become explosive. It's just like a bully at school when you don't know. When you live under those circumstances and your HPA axis, or your hypothalamic pituitary adrenal axis, that cortisol shooting out of your adrenals, those adrenals, your tribe knows, they sit on top of your kidneys, and they shoot out cortisol and norepinephrine, epinephrine. When you're under any stress at all, the body doesn't know the difference between good and bad stress. And you have got this chronic, long term stress where you never get the opportunity to dial that down and to rest and relax. And that in turn turns on that chronic lifestyle disease. It's quite simply, that's very simply put, is that can lead to, irritable bowel syndrome like me. And then you're getting into this leaky gut. And again, stress, nervousness, anxiety, and you're opening up those tight junctions in the gut there. And you're creating this, for me, it was IBS and joint pain and itching, but that's the simplified reason, is that you never get a chance to know. As a child, you never know when the bear is going to come through the door or when the incident is going to happen. And think about kids in foster care and taken out, and in and never knowing where they're going to be. And for my daughter, for her, it was being bullied in school, which had nothing to do with being at home. Like, you never know when you get off that bus or you walk through that door, what's going to happen. And that literally changes the neural pathways in the brain.
Right.
Isn't it unbelievable?
Yes.
And then you can turn on those chronic diseases, because I tell patients, you weren't born with high blood pressure. I wasn't born with lupus. I wasn't born with depression or joint pain or diabetes. We turn those chronic lifestyle diseases on. And I'm living proof, with a lot of work and a whole lot of therapy and controlling what's at the end of my fork. You can dial that back or turn it off completely.
Absolutely. Absolutely. So what's helpful, what I find that's helpful with actually doing the ACE score, is that some people have grown in those childhood situations and it's been normalized. They felt like, well, that just was normal for me. And sometimes they even think that's just what families are like, or that's normal for everybody, especially if you live in a community where there's lots of people in these kinds of family situations. So if you live, your next door neighbors are like that, and neighbors across the street are like that, and you live in a place of violence on a day-to-day basis, that becomes your normal. And then you don't know decades later, like, oh, this is why I have this problem and why it's not getting better. It's like, well, that happened. Yeah, that happened. Yeah, that happened. You become disconnected from your past emotionally. And sometimes you have to do that to be safe, to keep yourself safe, because it's hard to look at, but it's important to start connecting the dots and being able to eventually at some point at a pace where it is safe to do that and do the work. It is work, like you said. We've both been through a lot of work in therapy and working on yourself, but it starts with knowing that there is hope. There is an end. There's a light at the end of the tunnel. You just got to put one foot in front of the other on an emotional level and starting to connect those dots and seeing the dots connecting, right? Actually seeing those connections.
Oh yeah. And it's fascinating when it happens, but you talking about normalizing it and all, I mean, that is so true. And compartmentalizing it. That's what I did. I just compartmentalized it and got through it. And then I happened to have surrounded myself with friends who had strong families, who had nuclear families. My best friends in high school, their parents were married and they on the surface had good marriages. And, they're still all married. Nobody of my very best friends. So I aligned myself up with safety because I didn't feel safe at home. Right. And when you don't feel safe at home, again, you're in a constant state of fight or flight.
Right.
And it's all about safety. And I didn't feel like my mother, protected me at all. And so, yeah, absolutely agree with you. And
yes, I had the same situation. My best friend's family was very stable, married, and functional. And, I had a different situation. My mother was very physically and mentally ill, to no fault of her own. It's just, she had severe rheumatoid arthritis, to the point where she had gold injections in her knuckles. That's in those days, they were injecting gold into her knuckles. She was so sick. So I had to take care of the family of four, being the oldest. And my father was not a kind person, and I'll just leave it at that. But it's just, it was a difficult situation. And I knew I wasn't in a healthy situation because I had my friend's family to know what healthy was. Right. It's nice to have that something to compare to in your neighborhood, and other families in the neighborhood were healthier, I should say, not necessarily healthy, but healthier.
Absolutely. Yeah. And just think about, though, that, the people and the children who don't have that, like you said, who are living in a community that's just like them, and they're, which she talks about in the book, Dr. Nadine Burke Harris, the mm-hmm. Deepest Well, she's mm-hmm. the Surgeon General in California. Mm-hmm. Her book, The Deepest Well, is the best book I've ever read on adverse childhood experiences. And she's was in a very rough area, apparently, Hunter's Bend in San Francisco. I don't know that area, but all the majority of those children are the exact same. They're in very difficult, hard homes there. But again, you and I are living proof that you can turn this around. But I was never in therapy. I was never offered therapy. Even when I was molested by my stepfather, I will never forget that night. The police coming, him running down the hall, my mom chasing him. She must have believed me because she was in my room asleep beside my bed and he didn't know it. She had a huge fireplace poker with her, chased him down the hall that night, never saw him again. Police came. Do you know it was never mentioned? My dad never mentioned it. My mom never nothing until the day she said, "You caused me to lose the only man I ever loved." What in the world? Wow. And so now, and millions of men and women, just like you and I, are also in the exact same situation I'm in now. I'm an only child. My mom is an only child. My mother at 77 has Alzheimer's. Guess who her caregiver is? The only person to take care of her is me, 2.5 hours away. And I've had to really start back. I started back yesterday on working, even though I've dealt with so much. There are always going to be things in your tribe knows this, that pop up and trigger memories. Right. And last week for me, giving her a shower because she's no longer able to do that. No, it triggered me when she was mean to me in the shower. And I mean, it was exactly the way it was in high school. I had to really work on it. So this is constant. That's what I'm trying to get at, is this is nonstop work until the day we die.
Right.
On forgiveness, because you have to, if I can't forgive her for what happened, it doesn't mean I have to forget.
Right.
But I have to forgive to do the right thing and to be able to move forward for my health.
Right.
For my health.
Yeah. And it's important. I think it's really important to say right here that forgiveness doesn't mean that what they did was right. You're not saying that what they did was right or wrong. Clearly it was wrong. There's no question about that, but you can forgive someone because that's really healing you. It's not, and it might heal them too, but it's really healing you and letting go of your anger. Because anger, you mentioned it earlier, anger is what really kills you from the inside out.
You bet.
Yes. Yeah. And guilt. Guilt, shame, anger.
Oh, you bet. I mean, they even say there are studies that talk about anger, breast cancer and anger being connected and correlated. Your heart's right over or right under your breast there. And I often think of that. And, you and I who work with patients, the majority of my patients are autoimmune patients like myself, mainly Hashimoto's, but then we get into everything. Right. It's unbelievable to me because, again, we weren't born like this. And when we really start digging into this with our autoimmune patients, watching the light turn on, and when they do go get some help or therapy, or they talk through things with their mom. I mean, there's a million different ways, right, to work through this, or their dad, or wherever the abuse or that came from. It's unbelievable to watch their world start to turn around and their health start to return.
Right.
Oh,
absolutely.
When you get that burden
I work with a lot of autoimmune patients too, and I have Hashimoto's myself, so I know what you're talking about. So yeah, you see a lot of autoimmune issues as being a part of this complex as well as what, as well as gut issues, like you mentioned. Yeah.
Well, you bet. Well, think about the autoimmune with the Hashimoto's like you and I work with. And this is your throat chakra right here. And a lot of the work that I have done for myself, and I don't have Hashimoto's, but it revolved around my throat chakra and not being able to speak for myself or to fight for myself. Isn't that fascinating?
Yeah, absolutely. It is. Yeah.
And once you get your voice back, and with education, I think that's power and that's freedom. And, there's no price tag for freedom and there's no price tag for peace.
Right.
And ever.
Absolutely. Absolutely. So yeah, and working with the throat chakra really starts with working with your root chakra and your sacral chakra, the solar plexus. We're spending a lot of time in those areas and it opens up your throat chakra and then your heart chakra. And that's when you start releasing some of these emotions that are stuck in these areas. So yeah, so let's roll back a little bit. We talked about what the ACE score is, why it's important to know what your ACE score is, connecting those dots to chronic illness. Let's go to can you talk about like the first 3 steps? Like, because sometimes when you do the ACE score, it's like, oh my gosh, it can be a little like disconcerting. Like, you start feeling, oh my gosh, am I doomed? But I want you all to know that there is hope. It's just information. It's information. And I would love for you, Danny, to talk about what are the first steps that people need to do in order to, recover from these kinds of things. Because as you mentioned, you can do all the right things in terms of diet and movement and lifestyle changes. But if you don't really address this particular, I would say foods, infections, toxins, and stress, and this is under the realm of stress that is sometimes hidden from people. They don't really know what their baseline is. They're operating up here in overdrive, not even knowing it. And it's, what can we do to bring their cortisol levels down and have a reset that baseline, so to speak?
Okay, you cut out on me there for a second. So I think, what can we do to bring it down to baseline? So while connecting the eating well, sleeping well, moving well, pooping well, de-stressing well, cultivating community, right? Getting those. Well, for me, I think hands down, it starts with mental health, trying to start with something there. Now, the movement, though, I'm a big fan of yoga. So I taught yoga for years. There's a reason yoga's been around for 2,000 years. It works. And when you start working on breath work, your body starts to heal and you start getting oxygen to those cells. So yoga and the whole premise behind yoga and how it works emotionally, physically, spiritually, mentally, even sexually is fascinating and very healing. And that can be something free you can do, right? You can look online on YouTube and that. But I'm a big believer in mental health, in therapy, counseling. And some people listening may say, well, I can't afford a therapist, Danny. I can't go to EMDR. I can't have intensive treatment. Well, there are sliding scale therapists out there, and I work with every single one of them in Middle Tennessee here to help people get into a therapy center or a therapist or a counselor, whatever it is you need, because I am. Your friends are great. I'm great. You're fabulous, but we are not mental health experts. We're not trauma experts. And then when you really talk about this, you want somebody who is well-versed in trauma, who's a trauma therapist. Do you agree with me on that?
100%. 100%. Yes. Yeah.
You bet. And like I said yesterday, I just started hypnotherapy and reliving all of this. I had to type it all out. Oh my goodness. This week, just went down this week from 0 to 55. And woo, you talk about a hard day yesterday but freedom in releasing this. So hypnotherapy, but some sort of trauma therapist. Therapy. It is imperative.
Right.
Imperative. I think it's the key.
Yeah, great. Yeah. And there's other tools too that are helpful, like tapping, learning how to do emotional freedom techniques.
Oh gosh, one of my favorites. I'm sorry, I didn't even think about that. Tapping is one of my all-time favorites. You can always tell people who on airplanes, right? They're and emotional freedom technique. Nick Ortner is unbelievable. Yes. And I don't know if you've ever interviewed him, but he is incredible. And tapping is free.
Mm-hmm. It's free.
And it works.
Yes.
Meditation works. Meditation's great. If you're a meditator, I have this random crazy squirrel brain, so it's real difficult for me, but I think it's fantastic. Earthing, grounding, getting outside, literally in the forest or the park or your yard, barefoot, feet to the earth, face to the sun. I tell people every day, cats and dogs, pigs and cows, as a rule, goats and sheep, they don't have anxiety or depression. Most of them don't. They don't wear shoes. Their feet are on the earth. Their faces to the sun. That is free therapy right there.
Right. Absolutely.
Free therapy.
Yeah.
You study about forest bathing. There's a reason people live longer at the beach or the forest or, in the forest. I mean, those cortisol levels come down.
Yeah.
Whatever it is you can do to bring those cortisol levels down. Again, Absolutely. If you can afford counseling,
right.
Big.
So just to say a little bit about forest bathing and feet to the ground, and we're talking about bare feet, not feet with your shoes on, rubber shoes. And the reason I think it's important to say, because people may not understand why is that the case? Besides being out in the sun and getting vitamin D, there's also this exchange of electrons, right?
Yes.
Yes. That's really important. And when you live in a plastic environment, rubber environment, and you're not actually putting your bare feet on the ground, you are not absorbing all of those, what's the word I'm searching for?
Well, negative ions. You're not getting all those negative ions and electrons and all of that.
Right.
That's it. Yes. Feet to the earth, bare feet to the earth. You can tell the difference. I mean, if you've got wild kids, and they're just in the house there, you get their shoes off, get them outside. You get your shoes off as well. Get out there on that grass. People go get off in the weeds on that. Oh, the grass has got toxins and sprayed and all that. Just get your feet off. I mean, hopefully your grass doesn't, but if you're at the park, it's okay temporarily, right? But no, people live longer at the beach. There's a reason. The sun, the salt, the sea, the sand, all of those negative ions, all those electrons. I mean, think about that. You feel better at the beach. Most people, their anxiety goes down, their depression goes down. They breathe deeper when their feet are on the sand.
Right.
I love it.
Yes. So it's not just the air. It is being outside and connecting to getting your circadian rhythms and, connecting, there's so many things, getting away from electronics, getting away from all of this, stuff that's you're surrounded by on the inside, indoor environment. It really clears your system on so many different levels, and people feel so much better. So one way to de-stress and find that, or try to find that reset button in terms of lowering your what your baseline is, camping is a great way to people sleep so much better on a camping trip. It's just amazing. Mm-hmm. And it's not just because you're not home. There's a reason why on a physiological level it makes a difference.
You bet. There is a documentary on YouTube that is free. Maybe you can put it in your show notes. It's called The Grounded. Mm-hmm. The Grounded. Have you seen it?
Nope, I have not.
Oh my goodness. It is kooky, and it's out of Alaska. I think Haines, Alaska. This guy is brilliant though. And the entire town of Haines, Alaska turned around decades of chronic lifestyle diseases, diabetes, high blood pressure, anxiety, by grounding, earthing. Now, you don't have to dig a hole in your backyard and get in there naked like he does and lay in the dirt and the earth. I had a patient yesterday say, I watched it. I love it. I'm doing it. I just refuse to dig a hole and get in and I said, that's fine. You don't have to do that. But again, the earth, we got everything we need right here. We really do. But that's an easy one. That's a free one. But no, the research on camping is huge, and just spending time in nature. Absolutely. Look at the cows, the pigs, the horses, the dogs, the cats. They're not wearing the shoes. They're not anxious.
Right.
And they breathe. Just breathing, right? You can tap, but if you're holding your breath, it's not going to do any good. We go back to basics, to the cellular level of just breathing in.
Right. Yes. And I know some of my patients, and probably you have experienced this as well, that sometimes people do have trouble with breathing, and because as soon as they start breathing, they start feeling emotions, and then they stop. They hold their breath. So many people walk around holding their breath and just breathing up here. And so,
yes.
When you do start breathing, notice how you feel. And if you do have emotions kind of creeping in that feel uncomfortable, I think that's when you really need to have some support around learning a breath practice, so that it doesn't scare you or panic you or make you uncomfortable, because it's okay to be uncomfortable. The only way you can grow is by being uncomfortable. So but you want to do that when you feel safe. So safety is the most important thing first. Do not force yourself to do something that makes you feel unsafe. Number one, right? So, and so I think it's important to say that. And the other thing is to put yourself first. Because in order to do this work, you have to believe you deserve it, you're important, and you're investing time. You're not wasting time, you're investing time, in your health. So putting yourself first and creating that space for you is paramount.
You haven't read the de-stress chapter yet, but the de-stress chapter is all about getting your oxygen mask on first. Eleanor Brown, I think, first said it. You cannot pour from an empty vessel, but from when you fill your vessel up, it's from the overflow that the rest of the world is benefited from, right? But you deserve to have your oxygen mask on and to have a full vessel, period. It's not so you can be a better mother, a better father, a better worker. It's because you're worthy.
Right.
To be 150%. And you can't start from negative. You have to automate, eliminate, and delegate everything you can out of your life, right? Get some breathing room and get some air and some margin in our lives. As women, we tend to fill it all up, and we have no air, no margin for error. And especially coming from trauma. I know I worked 3 jobs to get out of that house in high school, 3 different jobs, got sick with mono. I have kept my world busy since I was a little kid, trying to please my mom, one of them, right? I kept going to school, never heard, well done, And so I think there are multiple reasons we fill up all the space around us, but you really need to sit back and say, what can I automate, eliminate, and delegate? Because I'm worthy to be 150%. And I'm going to start working on myself today. You
don't have to earn it.
Never.
You don't have to earn it.
No, you don't. And I was told my entire life, you do everything half-assed, Danielle. You do everything half-assed. And so I kept trying to prove to my mother, I'm not half-assed. Bull BS.
Right.
BS is all I can say. I have finally learned if I don't ever do another thing again, I am good enough and I don't have to earn anything. Exactly. And somebody needs to hear that today. But give yourself some margin. It's a piece of your healing. You can't, and now this is huge, Dr. Stein. When you go to therapy, like yesterday, when I went and did the hypnotherapy and kind of like EMDR stuff, do not get back in that car and just fly home to get the kids and to go to the grocery and go to the laundry, all the million things we do. You give yourself more time after that to let that soak in. What good does it do? But I did it for years, left therapy, left whatever, and literally just bolted to the next thing. Give yourself time to process.
Yes. Fantastic advice. Really fantastic advice. Yeah. It's really, really important to create space for the healing and for the processing that happens. And it's going to happen, throughout, and things are going to pop up randomly. So to expect that and know that, no, you're not going crazy. No, you're not losing control. It's just part of the therapy too. So it's very important that you do find someone to work with on these things that's knowledgeable about these, how trauma can affect you way later, even though it may not be continuing
That's right.
to happen, it can happen way later. I do want to say that
that's right.
There are some criticisms about the ACE score and its limitations, and that there, since that time has come out, the resilience score. So you can actually get a sense of resilience. Like, why do some people, succeed and others don't? And a lot of it has to do with resilience, and everything that we are talking about, that Danny has mentioned, these tools, is to improve your resilience. It's not necessarily to make your trauma go away, because it's always going to be a part of your life. You're just going to have a different relationship with it. And you're not going to be running away, avoiding, suppressing, pushing past, compartmentalizing, or stuffing it, and it comes out in a different way. You're just going to release it. It's going to be part of your history, but it's not going to control you when you're done with this kind of work. Right?
Bingo. Yeah. That is exactly right. And actually, we're never done with this work. I am so excited to keep going forward now, because now I know, Danny, you're not your past. You are not your past. You weren't responsible for what happened to you. Shame on them. That's on them. My job is to move forward. It is to be the best mom, the best healthcare provider, the best daughter, friend, all that I can be. But you're doing that for yourself, and you're not broken. You are not your past. One day at a time. And the more you realize that you're already resilient. You can take your test, you can do your score, all that. But if you're listening to this, you're sitting here listening to this today, trust me, sister and brother, you are resilient. You are one. Well, good Lord, you won the fight when you were conceived, for crying out loud. There were millions of them trying to get to you. You're already a warrior. And resilient. You just had a hard bump in the road there for maybe a few decades or maybe longer. But I'm telling you now, you can turn it around. I am living proof. Yeah. And it takes all your health may be pretty good, but your wellness is something that, your emotional, physical, spiritual, mental, sexual, social, financial, all of that makes up the wellness. Right. Nothing is ever 100%, right? All those balls are never in the air at the same time. But listen, if you're listening to this now and you're in Dr. Stein's tribe, you are already resilient. Now you have something else maybe you didn't know about. Read it, take the test, learn about it, but just know that's not who you are. Yeah. You don't have to die by suicide because your score is high. You don't have to have cancer or depression or anxiety. You don't have to. You can turn that around. Absolutely. Stop it. Absolutely. And you can stop the generational curses as well that stem from that.
Absolutely. It does not have to go to the next generation. That's so true. I'm so glad that you mentioned that. Very, very important. Yeah. So I wrote about the ACE score in my book as well. And we actually had a boot camp session yesterday, and we talked a lot about childhood trauma, and it is very prevalent, and people don't even realize it. And, the light bulb goes on, and it's like, oh, that's why I'm having chronic high blood pressure and chronic blood sugars, and all the lifestyle changes I'm making are not making that better. And it has to do with childhood trauma. ACE scores. Yeah. So you have to really then turn your head towards that and address that. And it is something that can absolutely 100% change. Yeah. Well, thank you.
That's exactly right.
Yeah, I really appreciate your time and your energy, and I love your passion that definitely came through here today. And I know that people will certainly learn from you today, and hopefully look at that aspect of their health and make some changes and have a healthier optimal life, right? With the goal of optimal wellness and not just normal. Yeah. All right. Thank
Amen
you
to
so
that.
much.
Thank you so much. I've enjoyed it.
Yeah, I will have all your information in the show notes, and some of the information that you mentioned, that movie, as well as the book that you recommended, The Deepest Well, right? Who is the author?
Well, this is Dr. Nadine Burke Harris. She's a medical doctor. She's the Surgeon General of California. I don't know if she still is. She has a TED Talk, 15 minutes on. That's one of the first ways I learned about adverse childhood experience.
I think I have seen that. I just didn't remember her name. Yeah. Wonderful.
She's the real deal.
Great. Thank you again. I appreciate it.
Thank you. That was fun. Thank you.